We all are who we are because that's how we've had to become in order to survive. And we become stuck in that persona because our contexts change and we need to readapt. But often we struggle to readapt. We don't quite know what to do, and we're immobilized, making use of the ways of dealing with the world that initially worked for us, making use of the defenses that initially worked for us. It is the job of therapy to help us to unpack why one has had to become the way one has become, what those conditions were that created your adaptation, and what is needed now in the present, what needs to change to allow you to survive better. So therapy is really about helping people to survive. It works only if you are willing to work with the therapist. A therapist cannot do anything to you. Whatever work is achieved is comes about as a working together. It's a co-creation of a new understanding. And this is very true of individual therapy. It's also very true of couples therapy, where both parties need to have compatible goals, whether it is that they're both committed to the relationship or they want the relationship to end. There are also a whole lot of other factors that contribute to whether couples therapy is likely to succeed or not. And this is that if there's too much rage in one or more of the parties, then the whole process will be sabotaged, and it's recommended that people go for individual therapy first. If there's an untreated addiction or an untreated mental disorder, that will sabotage the process, and again, individual treatment is primarily important. These are the factors that can sabotage individual couples therapy. But mostly, if both parties still love each other and they are struggling with certain issues, struggling with differences, with dealing with conflict, then coming for therapy can assist them to understand each other better, interpret each other better and often more benevolently, and teach them some better relationship skills.